is a good thing. And if you never thought about it that way, yeah, see, I knew I'd get some bug outs there. Mm-hmm. So pain's a good thing. It's chronic pain that's bad. Pain's a good, if you get your butt bit by a bear, that's a good thing if you have pain, right? It's your body's telling you, or stung by a wasp, that's a good thing. Your body's telling you to get away from it. And your body is always telling you, pain is an indication of tissue damage. So you have to address those underlying things, but pain comes from bones, muscles, nerves. Your body also has the ability to take care of the pain. It's better than aspirin. So if you get bit by that bear and you feel pain, but you still have to run, your body's going to produce things like so much stronger than aspirin, and you don't feel the pain. And how many times have you had an injury, you're like, that should hurt? Because your body's shooting down those enkephalins, endorphins to get you away from the pain. So your body has natural painkillers when it's appropriate to use them, and your body knows and has the ability to do that, right? So there's a time and place where you manage pain, and there's a time and place where you go, I have pain, what do I need to do? And so if it becomes a chronic pain, there's still those categories. What do I need to do to fix those chronic pains? And so I want to make sure that we address all of those. So there's different categories of healing. Acute stage of healing is the first 72 hours. That's whenever you have an injury and your body is sending out muscle spasms, your nociceptors are off the roof because your body's telling you, hey, something's going on. Stop what you're doing. This hurts. And so those first 72 hours, a lot of people want to manage the pain right away. You want to manage the problem that causes the pain, obviously, but then sometimes you still have to go to work. So that's whenever you want to manage the acute pain. I don't have the ability to manage acute pain except for ice and rest. And so that's where Jill would come in the picture. But by the way, this is Jill Cohen, Living Stones. The reason I love Jill is because she has the medical mindset, but she also has the ability to scale down and do more what your body's trying to tell you and working with your body. That I was like, we need to tell people about. And so that's why we're here. So as far as what's your opinion on whenever someone has acute pain, when you manage that pain or how you manage that pain and how you would do it?
You know, for acute pain, I do use medication. I mean, I'm a big fan of essential oils and of heat and rest and compression and all of those things. But I think there's a time and place for medication for pain relief. There is always an effect when you take a medication. Even the ones they say there's no side, there just always is. So every time there's a reaction, there's a counter reaction. So when you take an Advil, it's not as simple as taking an Advil. It's affecting your liver, it's affecting your kidneys. So I'm very cautious to take medication myself and to prescribe it. But you know, there's time for it.
And that's absolutely, and I always tell people you have to weigh the benefits and the downfall, right? Of it. Right. Indication for ice is the first 72 hours. Usually after that, you want to start doing heat. Well, if you've been in my office, people, and probably yourself included, people are, I'd rather have the ice. It just feels good. It causes the pain to decrease, but it also slows the healing process. It's the time and place for everything. The pain management is great at the beginning whenever it's acute pain, but you want to feel the pain. So if you're masking the pain, runners call it vitamin I, ibuprofen. Runners will take vitamin I right before they go run just so they don't feel the pain. Well, that's dumb, right? But that's a common thing. So the next stage is the repair stage, 72 hours to 14 weeks, depending on the tissue. We'll talk about that in a little bit. And then the remodeling stage, and this is the part people leave out, is once you start having pain, your body tries to get rid of that pain by healing the tissue. And then if you just heal, you get out of pain. Usually within a couple of 3-4 weeks, you're feeling better, right? That should be ideal for my office as well. And then whenever you feel better, the mistake that people make is, okay, I'm fixed because they don't feel the pain. But the remodeling phase can last up to 14 weeks to 12 months. So that's the important stage where you want to recondition the body and work on repairing the tissue for the long term so that you don't have frozen shoulder or scar tissue or things like that build up where you have things going on in the future. And the importance of that is a lot of chronic pain are people that never took care of the problem in the first place. So many times in the chiropractic office. So we want to address those things on how we address it in the office, and then also what you can be doing at home to make sure that you're able to address those things. So then what is chronic pain? Chronic pain is anything past the stage of what your body should be healing at. So let's say you're in the remodeling stage about 3 months out and you're still having pain. That starts being dangerously close to the chronic category. And so whenever your body should have been repaired and you should be feeling better, then it becomes chronic. There's different types, and this is where we get into the meat and potatoes, and then we open it up to the good stuff. Different types of pains are caused by changes to the nervous system, immune system, with ongoing inflammation and the repair in your body having to constantly process and repair. Brain processing, and that's where, and we're going to talk about it, so I'm not pointing fingers or anything, but if it's all in your head, that's a scientific thing. And so there is some of that. Then degenerative and neurological. The first kind of category is central sensitization. I told you there'd be some big words. That's whenever your brain becomes, or your nervous system becomes oversensitive to stimulus. So even just a gentle touch or a gentle movement is overstimulating. And this happens a lot with people that have had to take opioids. So do you give opioids in your practice?
Okay.
So I just want to point that out. I told you I love Jill. So whenever I send for pain management to people that will remain unknown, they have to use opioids sometimes, and that's fine. But I want to do every step before having to use opioids. Your body has natural opioids, more amazing than our opioids with no side effects, and your body knows exactly when and how much to use them. That's the enkephalins and endorphins and things that I talked about earlier. But whenever they have widespread pain, that becomes the category of central sensitization. Persistent pain, even whenever tissue heals, like I said, movement, manual therapy, graded exposure, that's really important. We used to think, and even whenever I got out of chiropractic school 20-some years ago, you would stabilize and don't move it and let it heal. Now they know that a load under pressure, like you're using the muscle, you're using that joint under pressure, will actually help you heal better. And so they actually, if you think about, if you have any kiddos or grandkiddos that have broke their arm, a lot of times they don't even put casts on anymore. They'll let it be and let your body heal more naturally by having the pressure on it. If you're not moving, a lot of the reasons that people don't move is the chronic pain, or they don't have the energy, or weight loss. So I know Jill has some tools in her tool belt for weight loss, and you can go into it as much or as little as you want to, but I wanted to open it up for you. To me, in this category, nutritional support for healing, and then weight loss to help with movement so that people have the ability to go out and move. I know I have people in my life that don't have the ability to exercise or walk even because their knees hurt, and their knees hurt because they're overweight, and whenever they can't walk because they can't lose weight because they can't walk. So it's this vicious cycle. So do you want to touch on
Sure.
weight loss?
I was in a family practice clinic, and the doctor that I worked with had been in practice for 40, 50, I think he was 50 years, and he was prescribing phentermine for weight loss. And I don't like that medication personally, and I see what it does to the heart. And so I questioned him on it, and I said, I don't want to, I know this is your practice, but can you explain to me why you're using phentermine? Because it seems like a really bad medication. And he said to me, I have weighed the benefit. And when someone is 200 pounds overweight, and he said, I've seen people that large, and they are so unhealthy. He said, I weigh the risk of the phentermine versus the weight, and the phentermine is the one I choose because excess weight on your body is so deadly. And so we had lots of conversations about it, but he had so many people on phentermine. I'm like, surely there's a better way. Well, this was pre-GLP-1 agonist, the semaglutide, Ozempic, all those. And so I actually do use those in my clinic. And I've had some pushback. I'm kind of a weird anomaly. I try to kind of walk between Western and Eastern medicine. And so the people in Western medicine think I'm way over here wacky Eastern. The people in more Eastern medicine are like, why are you prescribing an antibiotic and why would you give GLP-1? But I just feel like there's value in both. And I have had great success using the GLP-1 on some patients. I don't think it's for everyone, but I do prescribe that when it's necessary. And when I go into it, I explain to patients, there are risks with this, and I'd like to get you in and out. Let's do it 3 to 6 months and then get you out. And so that's the way I approach all medication. I feel like medication has a purpose for a short time, but I don't like to keep people on medication ever.
In order to exercise and move, I think weight loss is a big part, the obstacle that a lot of people overcome. Neuroplastic changes in the brain. You can do an MRI that shows, I'll read this to you because increased activity in the anterior cingulate cortex, emotion of pain, altered connectivity with the default mode network, and reduced gray matter and the prefrontal blah, 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 right? And so you can see it on an MRI though, or they've done studies that indicate that whenever you have chronic pain, it can affect your brain. So it's cause or effect, right? You have the chronic pain that affects your brain and now it becomes a loop. The next category, which I'm going to bump into, biopsychosocial amplifiers, and it's brain amplifies your pain. So it's not like it's causing the pain like some of the other processes, but your brain amplifies the pain. And that also goes with stress and emotions. So stress and emotion increases or over exaggerated emotion, fear avoidance and things like that actually increase your brain's processing and shooting a signal saying this hurts. And I have firsthand experience with tons of patients, and a close friend of mine, this person went into the doctor and the doctor did all the tests and said, this is what you have, and it has nothing to do with any tissue damage, and it's in your brain. So stress management is a huge thing. So two of the categories that we're talking about today, managing your stress is a huge part of that. So again, there's nutritional products and things. I don't know if you want to touch on that, if you have any stress management type things that you offer in your office.
So I do biofeedback in my office, which helps with anxiety. I've got quite a few patients that use that to help kind of calm them down. It works really well. And then
explain what biofeedback is.
So,
and it sounds a little weird, but I have patients that just swear on it. Yeah.
Everything in our body is electrical, right? Our cells are protons, neutrons, electrons. We're electric humans. And if your heart goes into arrhythmia, if your heart stops, we can use electrical conduction to get restarted. So we put a defibrillator, and I've done this many times. I used to work cardiac care. So it just makes sense that you can do things like grounding makes sense, to put your feet on the ground and ground. Biofeedback is similar. It kind of grounds people. It's not for everybody. Some people do it and say, I couldn't really tell a difference, but I've had a lot of success with autistic kids and with anxiety.
Can it pinpoint the source of your pain or issue?
Sometimes, yeah. You kind of have to be careful. Yeah, you kind of have to be careful with it. And because it's just not as precise as you draw blood work and you get a certain, because it just picks up on frequencies of things. So, yeah, I love using biofeedback. I do it pretty much every day, and I think it's really helpful. As far as supplements, anything that helps with your adrenal glands, because when you're stressed, your cortisol levels go high, and that affects your stress. I've also been recently doing a lot of the methylation blood testing. I don't know if y'all are familiar with that. I love the methylation testing. So there is a genetic defect. Y'all might have heard of the MTHFR. That's been around. People have been talking about that for about a decade. But they've identified others, like there's one called COMT, which stands for catecholamine methyltransferase. And with the COMT defect, you can't process cortisol well. So people that have the COMT defect, their cortisol levels will rise and it's hard for them to come down. So they've found that if those patients are methylating well, they can move that COMT through better. So I do a methylation test, and it's just an incredible test. It gives me so much information, and I've done over 200 of those tests now. It's just great information, but about 40% of Americans have the COMT defect. If you have that, your anxiety can get up here for no reason or for a reason, and it's just hard to bring it down. Magnesium glycinate is one of the things that kind of helps move it through the cycle, but also having all your B vitamins and all of that helps with it. So
some people will take a B vitamin and their energy level and their spirit is through the roof, and some people take a B vitamin and it won't give them that effect, and be like, I didn't feel anything. And it might not necessarily mean that they don't need B vitamin. It might be that their body doesn't have the ability to
methylate. Yeah, so if you're not methylating, it can get stuck. So there's all these different pathways, and this test shows where you're stuck. So it's just an incredible test. The people that have done it in my office, I haven't ever had anybody say, oh, that really was a waste. I mean, it is incredibly helpful information, but you can just see where you're stuck in the pathway. If you're taking B vitamins and they're not affecting you, it could be that you're stuck. And usually when you're stuck, your homocysteine levels rise, and that's when you get into high blood pressure and all that, because homocysteine is inflammatory. Homocysteine is the culprit, not cholesterol. But what happens when your homocysteine levels rise, the cholesterol goes to try to help. And then we don't check for homocysteine usually, we check cholesterol, and then everybody gets put on statins to get the cholesterol down. And it's like your firing all the firefighters. You're sending them away and the fire's still going. We really needed the cholesterol there to help bring down the fire.
If you're treating someone for cholesterol, if you're managing your diet and they're taking a statin, and then you wouldn't necessarily yank them off of their medications necessarily. Like, you could guide them down through the process to support their body's ability to manage with the test, to be able to give them the nutrients they need to bring them back so that they could lower the medication. Is that too much?
Honestly, I yank them off.
You'd yank them off?
I yank them off. Because now you can't do that with everything. With steroids, with, there's a lot of medications, with antidepressants, with anti-anxiety, you never yank off. But statins that is a medication that you can just come off of it. And one reason I'm kind of passionate about it, and I hope I'm not stepping on anybody's statin toes, but I just personally have had some really pretty serious experiences with statins, so I'm just not a fan. And there's a cardiologist that talks about the dangers of statin, and he kind of got blackballed by the cardiology community. And I've worked with a lot of good cardiologists, so I have a lot of respect for them. But I wrote my thesis on dementia and the tie between dementia and statins, and there is definitely a link. So our numbers of dementia are going up, 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 and our use of statins are going up, up, up. And so your brain has to have cholesterol to function. And so when we're getting rid of the cholesterol, how is our brain going to function well? I feel like we've got to question everything.
So I want to clarify too, the two tests. I mean, you could do a regular blood test panel and do does it show you the cholesterol and the
You can, and you can ask your doctor if you haven't had a homocysteine level. I can do it, or you can just ask your doctor. If I have patients come in and say, I really can't pay that $600, and this is not a test covered by insurance, because as we know, they don't like to cover things that they don't want to cover. But they will cover a homocysteine if the doctor orders it and if they can show, and there's an ICD code that you can put in so that insurance will cover it. And so if I have a patient that says, I really need to know if my blood pressure is because of something methylation-wise, then we can order a homocysteine level. And, I've done that for people, and it's like 16. It should be 8, so it's twice what it should be. And I'm like, okay, we've got to get that level down, and then your blood pressure is going to get better.
A blood test will also show the cortisol level, right? In the blood?
Yeah, you can check cortisol levels in the blood test.
Whenever you have stress, it affects the cortisol level, and then you get in this vicious cycle of increased cortisol, increased pain, increased stress, increased cortisol, and then so you have this vicious cycle of, you can not just support the pain, not necessarily just support the cortisol level, but decrease the stress, decrease the cortisol, treat the adrenals at the same time, that they all work together. Did I say that correctly? Yeah. And so that's not necessarily a hard thing to do. There's a lot of resources out there for that. And Jill could help you with the blood test on that, and then the support standard process. I will say too, real quick side note, on the standard process thing, I did a purification with a patient once. And he said his family history is high cholesterol. None of the men in his family have ever had normal cholesterol. And he said, on purpose, I did a test before, and then after the purification, he did a blood test afterwards. And for the first time in his life, he was in the middle range of cholesterol. And so, just showing that if you do treat your body right. And so that's huge. Peripheral sensitization, that's a neuroinflammatory loop. So sometimes you get in this vicious cycle of pain and inflammation like we talked about. And that goes with chronic inflammation. So a lot of times indications of that, when people come into my office and they have pain all over the place. If someone comes in with a shoulder issue, they have a shoulder issue. If they come in and they have a shoulder and a neck issue, sure, I can put that together. Shoulder, neck, knee, they have shoulder, neck, knee, ankle, elbow, wrist, then I'm thinking inflammation. Whenever you have stress in the body or tissue damage in the body, your body will shoot off indicators to inhibit the pain inhibitors so that you feel more pain. So if you have chronic inflammation, your body's always spitting those out, not allowing your body to shut off the pain, so you have more pain. So again, not just going after the pain, but treating the underlying stuff is really important, but then also getting the stress levels down, inflammation down to begin with, and then it'll reset the cycle. So obviously, we talked about anti-inflammatories and a lot, and I talked about that earlier as well. Anti-inflammatory process is not just taking an anti-inflammatory just because you have inflammation, but whenever it becomes chronic, or supporting it with some kind of supplemental thing to help your body deal with the stress, and the inflammation is huge on that. Another one is omega-3 fatty acids and things like that. There's a test, I think it's saliva. You send it in and it tests the omega-3 fatty acids in your system. I was told that even if you're taking omega-3 fatty acids, they may not be good ones, and you may not have omega-3 fatty acids in your body. And so that's an easy fix. That's super inexpensive. You can get that anywhere, but you can test it super cheap to see if your body has enough of that. So that's another thing that's just a simple support your body in the inflammatory process to get that inflammation down. I wanted you to touch on the ScanR though.
Okay.
So tell us about what the ScanR is, and then as far as how that affects inflammation, because I was flabbergasted whenever you told me about it.
My first encounter with the ScanR was at a functional medicine person when my oldest son was playing football his senior year of high school, and he was having incredible pain, gut pain. And so we tested him, and he had all these food sensitivities. And so this doctor used this device on him, and it stopped his pain, like flat stopped it in the middle of him having an attack. And so I asked about it. She said, so it's called the ScanR. It was invented by these Russian astronauts. They were going to use it in space for any health issue. And I thought, okay, that sounds like a made up story, but okay. It just sounded strange to me. But she said she had to buy it in Australia because it was not FDA approved for use in the United States. I'm like, okay, that sounds even more sketch to me, but okay. But it worked. And so a few years later, I was having what I thought was a gallbladder issue, and I was just like having spasming in my gallbladder. So I call her up and say, will that ScanR that you used on my son work? And she's like, yeah, come on in. So it stopped the spasming that I had. And then a few times after that, it happened again, and I went back to her and it stopped it again. So I'm like, okay, that's a pretty cool thing, but it's illegal. Not illegal, but it's just not FDA approved.
Accepted, yeah.
So I just
a lot of good stuff are.
I know. I just kind of dropped it for the time being. And then when I got my own practice, I had a patient that came in with frozen shoulder, and he had just done everything. And he said, my next step is surgery. And he was coming to me for weight loss, actually. And I said, I know this doctor that does ScanR, and I'm assuming she still does it, so go see her. So he's like, okay. So he goes and sees her, and it's incredibly helpful. And so he went to see her, and, she charged him $100 a session. He came to me and said, how come you don't have that ScanR in your office? And I'm like, well, because it's $3,500. That's a little too rich for me. I just started my own practice. And he's like, okay. So a few days later, his wife called me and said, hey, my husband and I were praying, and we think we're supposed to buy you a ScanR. And I'm like, you're kidding me. So they bought me a ScanR, and so now I use it. You can call it Scanner, you can call it ScanR. It's spelled SCENAR. The interesting thing is it became FDA approved in 2022, and now there's a ScanR distribution office in Fort Worth. So I went there and got my ScanR, and now I have it. And so I'm still seeing that man did not have to have shoulder surgery. He comes to me about, the more you do it, the more it helps. So you can spread out your sessions. And in the beginning, he was coming once a week to get the session. It's like a 4-minute session. It's very quick. And then he spread it out over time, and I see him about once a month. I also have a police officer that comes once a month for ScanR. And I saw him today, and he's like, I don't think I need to come see you as often. I'm like, that's the goal. I'm not trying to keep people sick. I'm trying to get people well.
I have a hip and a knee, and both of them said,
yeah, you sent a shoulder to me too.
Did I send a shoulder? Okay, yeah. So, but I've had patients come back firsthand that said, Doc, that was crazy.
It is crazy.
And what's cool about it too is, doesn't it spits out a reading at the same time that you do it. So it's not just putting something in, but it also does a reading.
It's similar to a TENS unit, if y'all are familiar with that. They've been using that in physical therapy for decades. And I've used it on patients in the hospital. But the ScanR is unique in that it reads the level of inflammation. You put it on the area of injury, and it'll show you where the pinpoint, the area that it's damaged. And then it'll tell you how much frequency to send back into it. So it's just much more intelligent than the TENS unit. But the TENS unit has been FDA approved for 40 years, and insurance covers it. Since 2022 is when the ScanR got approved. I expect in 2032, probably insurance will cover it, but that's going to be a minute.
Yeah, and I will say too, piggyback on that with the TENS unit, and probably the ScanR as well, is we were talking about acute pain earlier. If you want to trick your brain and not feel the pain, that's a good option, because your pain is a good thing. inflammation's a good thing, but if you want to reduce your pain because you're going to go to work or whatnot and not have to take a medication, something like that is a good option because you're working, again, with the body. You're tricking the body with the TENS unit, but it's a topical trick, right? It's not putting something into your system, so you're not having to deal with side effects and things of that. If pain persists beyond the time that it takes typically to heal, that's whenever it becomes chronic pain. Sensitization, neuroplastic changes, we talked about that, the nervous system, the brain. Movement avoidance, that's huge. Whenever someone has neurological issues, and let's say they have pain going down the right leg, I'm adjusting the right leg to send that message to your brain, control movement so that their brain is stimulated so that it'll actually help decrease the pain in that area. So that's huge for neurological, and every pain category is making sure you're able to move, whether it's because you're overweight, you're not moving, or because you don't have the energy. Let us help you get that movement going. That's so important. And then you get into the degenerative and neurological, which is where I want to spend the last part on, and I'm going to open it up to Jill to talk about, and then I'll just interject questions whenever I have questions, because I have a lot of questions about it too. So talk about stem cell.
Okay, so the way I see it is similar to how I looked at the scanner a decade ago. You know, I'm like, okay, I see it helps, but it's not FDA approved. Why is it not? All of that kind of applies to stem cells now. And I feel like another decade, it's going to change.
I think it's dramatically changed in the past decade, though. I think at first it was a big stigma, and now there's people asking me about it all the time.
People are more open to it, for sure.
Go ahead, sorry.
So we're getting there. It's always slow until something gets approved. Now, of course, when things get approved, then the cost goes up.
Yeah.
Once the FDA approves it, and I think it's just a matter of time because people, you know, American citizens are flying to Tijuana to get this for $20,000.
I have patients that they're doing that.
I do too. So, well, before I started doing them, and now they're not going to fly anymore.
And I asked him the price. I asked you the price the other day, and I asked him the price the other day. He's paying more to go to Tijuana to do it than he was.
Yeah, it's crazy. I was introduced to it by a couple who had a massage clinic and they were wanting to get into stem cells, but they're like, we have to have somebody to inject the cells, and it has to be a nurse practitioner or a doctor or a PA because it has to be somebody that can do joint injections. That's how the whole conversation started. I'm like, that's interesting, but I don't know much about it. Well, I had to go through training, and I told him I would do it, but I had to go through training to do the joint injections. So I was sent to a clinic in Garland called Achieve Vitality, and I was pretty skeptical actually, but I wanted to do it for them because they were offering to pay me to do it, and I thought if it helps people. I was there for about 3 weeks, and most of the patients that came for these stem cells were repeat patients who had been there a year before or 2 years before. People were flying from all over the place, Oregon, Washington. And so I questioned them, and that's how I got sold on it, is just by talking to these people. So I wasn't sold. I think you and I both went to a seminar and heard about it, and I just wasn't sold. Right. What sold me was talking to the people that had actually had the stem cells, and that's how I got convinced it was a good thing. And I heard all kinds of stories. Macular degeneration, one lady came in and said she had been told she had that, and there was nothing you could do for it. And it is regenerative versus degeneration.
That was one of the points I wanted to make, is it's helping your body, it's working with your body. It's not making your body do something. So tell us what a stem cell is if you don't know.
So stem cells are undifferentiated cells that are present in newborns. Well, they're present in everybody. When you're 80, 1 in 2 million of your cells are stem cells. But a newborn is 1 out of 10,000, and those cells go where they need to go to develop bone and cartilage and grow baby's teeth and grow baby's hair and become, help the brain function. The corpus callosum that separates the right and left hemisphere of the brain, it starts developing that better. They seem to be intelligent.
Yeah.
Crazy, but they do. Yeah, they know where to go.
So in the infinite wisdom of your body and the powerful creator that made it, it puts little baby cells in there that go where they need to go, when they need to go, and regenerate what they need to regenerate and grow what they need to grow. Right. That's what a stem cell is. Yeah. And everybody has it. You have stem cells in your body. It's not this weird thing that is, you got to get it from, a bad source or whatever. It's little cells that everybody has that we can concentrate and do magical with. So how does it work then? They're like, where do you get the cells? That's a good thing to...
Yeah. So, there was a time where they were coming from aborted fetuses, I assume. That's what I heard, which is illegal. And so that's not happening anymore. I think it might have been happening in the beginning. I haven't done enough research to know exactly when that started, when that stopped, but that is not what this company does, and it is illegal.
Important to know, yeah.
Yeah, it is illegal in the United States.
That's, I think, a lot of the stigma with stem cells right at the beginning. That's, I have head dots all over.
And And, it makes me nervous when people are going to Tijuana because I'm like, do you know where they get their stem cells? I mean, it may be something like that. They get them from C-section babies and women who have donated these. They sign a waiver. They fill out a questionnaire they ask them all kinds of things down to, did you get the COVID vaccine? And just because there's controversy about that and some people don't want any remnant of that, if anybody says yes to that question, they go ahead and rule them out. But if they say no, they did not have the vaccine, they still do. They look at it because they can look for the spike protein in the microscope. So they do a lot of investigating to make sure these stem cells are as pure as they can get them. With stem cells, I don't know if any of you have had blood transfusions, but if you have a blood transfusion, I've given plenty back in the day in the hospitals, but you have to type and match your blood type because you can have a reaction. There's none of that with stem cells because they're undifferentiated. One lady that was thinking about getting stem cells, she's like, how do I know if I'm getting DNA that's girl or boy, XXXY? And I'm like, no, it's not that because they're undifferentiated.
So you're not going to grow another limb because your body thinks it needs a limb.
Right.
That's going to go to the area. So how does it know? We don't know that, but what's the philosophy? Because there's different philosophies on injecting it straight to the joint or just injecting it into the bloodstream and letting your body figure out what's that process?
Yeah. Well, that's my preference. I don't love giving joint injections. For one thing, it's more painful. But the other thing is these cells are very smart. And maybe it's going to go to your joint that's in pain, but you have cancer cells growing that need to be dealt with. And so I would prefer these stem cells go where they think they need to go because they're smarter than me. They know what to do inside a body. I did have one lady tell me, and this is from all my days of training at this other clinic, she went for stem cells hoping it would help her rheumatoid arthritis. So she was kind of discouraged because about a month after, her arthritis was still bothering her. But she went to get her glucose checked and her doctor's like, we got to back off your insulin. They lowered her insulin. She went back again. He's like, we got to lower your insulin again. She kept going back and she finally got off insulin. And so that seemed to be where the stem cells wanted to focus, which makes sense.
I was going to actually comment on that.
Yeah, it just makes sense.
Sorry, your chronic pain didn't go away, but your kidneys are better.
But you've got to get your blood glucose under control. So I think that's a good thing about them is they seem to know where to go. If somebody insists on getting in the joint, one of my patients did. She's like, my knee is the only thing that hurts. There's nothing else wrong with me. So I'm like, okay. So we did. She did get it in her knee, and it definitely helped. She's looking at doing it again because it was about 2 years ago. And she's saying, I'm starting to have some pain again. I think I want to do them again. Most people that have received these talk about when I do them again because they've had such good results. The initial injection is 18 million, I wrote it down so I remember, 18 million per cc. But at the end of 6 months, it's up to 2 billion.
So they grow, they multiply. And that's that's the effect of the stem cells is it gets in your system, attacks, if you will, the bad place that needs to be regenerated, and then deals with that, grows and helps support that growth of the new tissue and heal that area, and then it continues to get to multiply and get more and more and more. So I've had patients that have done stem cell that have less pain a month, but then in 2 months they have less pain than that because it gets better and better. Right. So why would you then, if you do the stem cell, it attacks the area, why would you need to do another one? Or is it a permanent fix? Yeah, because that's what you're looking for.
Yeah, and some people, that is what I'm told. This is all new to me, really. I haven't been doing this for a long time. But according to a chief Italian, Dr. Darcy, there are a lot of people that just do it one time and they feel like they get fixed. And so they don't come back for a repeat. My father-in-law is one that he was diagnosed with leukemia in January last year and was told under no circumstance would he live more than 6 months because his white blood count was so high. They said it's just not compatible with life. And they said, you can do this. We've got some immune boost kind of things, or we can do some traditional stuff, but 6 months is the most you're looking at. So he asked me, what should I do? And I said, stem cells without a doubt. So he got those in March. And he's like, I think I might feel a little different, but he wasn't sure. In June, my mother-in-law sent me a picture of him on the tractor plowing the field. He's 85. And this was a man who could barely get out of bed in January. Yeah.
That's great.
And so he hosted Thanksgiving at his ranch this year and had everybody come. I called him and said, Dad, do you want me to bring some? He's like, no, just come on. I'm cooking the turkey. And
What?
so at the Thanksgiving gathering, he said, hey, do you think I should do this again? And I said, I cannot tell you what to do. It is totally
I
up to
cannot
you.
tell
You
you what
know,
to do.
yeah, you do whatever you think is best. And he decided that he did want to do them again. So he's set up for another appointment. Every time they check his white blood count, the numbers go down. So his were up there between, it was around 70,000. So the normal white blood count is 8,000 to 12,000. That's where you want it to stay. You don't want it to go too low because then you can't find infection. Too high is inflammation. So his were close to 70,000. They were way up. And so every time, and they weren't just high, there were also all these abnormal cells. You know, you can have different types of white blood cells. And he had all these weird, some of them I hadn't even seen the name of them. I got his lab report and I'm like, oh, he's got some strange white blood cells. But the last report he had, his white blood count was 20,000 and there were no irregular shaped. It was just all regular white blood cells. Yeah.
That's cool. So it literally is close to like the fountain of youth. I mean, that's what it's like. It's like injecting the fountain of youth inside of you so that your body, and it's natural and it's your body already has the ability to do. That's pretty awesome. Okay, so tell me the process. So that if I said, yes, I want to do stem cells, what's the process? Like what would it look like coming into you?
It's just like getting an IV, basically. We just hook you up to I think other people do it differently, but I like to hang a bag of IV fluid and give you the IV fluid and just kind of make sure we get all the stem cells in.
Question, so how do they actually harvest the stem cells?
So they get them from the umbilical cord. They do the C-section and they get the umbilical cord and then,
And they're donated.
yes, they're donated.
Yeah, they're donated.
Yeah. Now, I think that is probably going to, so the hospital charges, Infinity goes in and they charge.
Right.
But they're donated from the mom. Now, I think that's going to change. I think moms are going to get wise pretty soon and go, wait a minute, can I charge for
to
that?
have this baby.
Yeah, well, my daughter just had a baby, and she's like, what are you doing with that? And they're like, oh, we discard of it. They said, and she's like, well, what if I want it? And this was before I was really into stem cells, because now I might grab it myself.
Yeah.
She's like, but what are y'all going to do with it? And they said, oh, well, we take care of it. If you want it, you're going to have to figure out you'll have to pay for somebody to preserve it and all that. And she's like, okay, but yeah, that's a good question. Yeah.
Sorry, y'all, this is
No, this is
TMI.
great. No problem.
What is the difference of harvesting it from an umbilical cord if it's a C-section as opposed to a vaginal birth?
No, that's good.
That is
I was
a
wondering the same
really
thing.
good question. So, yeah, not a dumb question at all. I think it's just considered cleaner.
I just was watching a guy that was talking about he had knee problems and he's in Florida. The doctor harvested his own stem cells and then put them back in. And and they put them into the knee and he's like a new knee.
Yeah, some people have good success with that. It depends on how many stem cells you have. So they say, when you're 50, you have one in 450,000 cells are stem cells, so not very many compared to a newborn. But if you have a pretty healthy stem cell lineup in your body, then it could work. I think it's about 50-50. I've talked to about half the people I talk to that it's called autologous when you give yourself your own stem cells. I think about half the people it helps and the other half it doesn't. And so,
He
yeah.
said they harvested them and then they grew them. So
Yeah,
like,
they try to stimulate them to grow some more. And some people can and will.
yeah.
But it's kind of hit or miss with those, it seems.
My granddaughter has ulcerative colitis,
Mm-hmm.
which they have said is incurable.
Oh, I hate it when they
I
say
know
that.
I know that. They're not believers. But so they accepted that. But I mean, she's already gone through one medicine that's quit working and she's been on steroids and she's in college. Can I give your information
Of
to my
course.
son to contact you?
Yes, I would love to help them.
It sounds like something that would
Mhm.
benefit her.
I have helped some people with that. I mean, I just feel like anything they say you can't. I have so many people come to me, their endocrinologist told them that they have Hashimoto's, which is when your body attacks your thyroid. I have had so many people come to me and they said their endocrinologist told them they would never, those numbers, the antibodies would never go down. And I have helped so many people with their antibodies come down. And it's not anything I'm doing, it's just
Like, let's support your thyroid. But yeah, it makes me crazy when they tell people that there's no cure or you can never get off this medicine. They tell people that too. You'll never be able to get off this medicine. That makes me crazy too.
Well, thank you so much thank you for coming and doing this. I think that worked out all right. That was good.